All right. Hey, everyone. It's Dr. Drew at Revival Health Center in Clive, Iowa. I'm excited for today. This is fun. It's cool, the kind of meeting of the brains. I'll try and stay on topic with Dr. Cody Kriegel. He's a dentist, a biologic dentist at Corridor over in North Liberty, Iowa City area. My big goal for today was just kind of continuing to level up patients, giving them good just tidbits on their health overall, how to keep improving, and also what to maybe remove from what we're doing on a daily habit too. With that being said, Dr. Cody, if you don't mind, like in your vision, what do you think of as biologic dentistry? And then from there, like, how did you get into it, and why are you so passionate about it then too?
Sure. Yeah. So first of all, thank you for putting this together. Great minds. When we meet, I just love it. And there's so much to learn from you, of course, and from all of our patients together too. There's a lot going on out there. So it's great to have everybody come together. So biological dentistry, in a nutshell, what I call it is, I mean, you kind of said it first. It's an up level of dentistry. I feel like too long dentistry has been too reparation based. We're trying to construction mode in a sense, where we're trying to repair things, and you look at something, you repair it, and then you go on. We're not integrating, I'll say, kind of the medicine side or an integrative, holistic side to dentistry. And as you know, just as much as I do or more, the teeth and the mouth, I mean, it's part of a bigger system. It's not just this innocuous thing that we have to take care of. I mean, each tooth is an organ. It's connected to the system. And so biological dentistry is kind of, I'll say, a fusion of high-tech dentistry. Of course, we're always trying to use the highest tech that we can. And of course, we have to repair things, but we need to look at the system, and the organism is what I usually will say from a holistic standpoint, and saying what else is going on in the system that's affecting the teeth and vice versa.
That's perfect. I actually had someone recently ask me, like, how do you put chiropractic in a holistic view, right? And it's that connection of, like, we're really trying to restore that brain body connection. And we think about all organs and all body systems correlate to each other, right? And so I always tell that if you're doing a great job with your taking care of your spine, you're doing your chiropractic care, your nervous system's getting better, but you're still inundating your body with stress. Like, say you're still going to fast food every night, right? Or say you haven't, like, moved, whether it be a walk, yoga, CrossFit, you name it, for months, let alone years.
Yeah.
It's still that getting people to improve their lifestyle too here. And I think about that. I always say it as a compliment, like, oh, you guys are different in how you approach things. Like, I take that as a compliment, almost, and like as a badge of honor, that, like, oh, we see things and talk about things differently as far as your health too. And I think people get that same sense from when they walk into your office too, if that's fair.
Yeah. No, I mean, personally, I think chiropractics is kind of like the true doctor of the day, I think, and too much when we go out into our, like, the way our systems are designed, I'll say it that way, is that we're very myopic in our viewpoints, right? You go to a cardiologist for your heart, you go to a pulmonologist for your lungs, you go to a GI doc for your GI system, right? So we're kind of subconsciously segment things, and we don't realize how there's so much interplay, and the body sees it's all as connected. And when you have an issue in one area, that can topple over or fill that cup up into another. And so, and you said it first. I mean, if you're, I mean, I'm very fascinated by the nervous system. So if that's not firing appropriately, right? I mean, we see people all the time, as you do, in just chronic sympathetic mode all day, every day. And so if you can't get them at least tipped into a parasympathetic, at least a little bit, and start getting those repair processes going, you're going to be fighting an uphill battle.
Yeah, no, it's so true. And I think about when people come in here, it's like, hey, if we are your one time in the day or the week or whatever you want to say, to actually move your body into a parasympathetic state, take a breath, and actually, like, get your shoulders out from under your ears, I feel like I'm doing my part, right? Let alone, like, everything else that comes along with that. But that's actually something I was going to go over with you, if you don't mind. I've just been looking more into, like, our overall posture, right? We talk a lot in our office about forward head posture, text neck, and how we just are, unfortunately, that snowball keeps rolling. And people coming in here,
yeah, man,
like this, right? And
yeah,
it just, like, and the research actually is how, when it's changing actually our mouth or our oral posture too, and how people are mouth breathing more, affecting
yeah.
the bacteria more, gut issues. Like, so if you don't mind going a little bit more on that too, like, but I just see all the time where I'm here, and so I'm just stuck, that much more pressure. Sorry, that may not be a very good viewpoint, but, like, getting that inability to breathe normally, affecting so many bodily parts then too, right?
Oh man, that's like an open waterway there. Yeah, there's so much there. Yeah, I think For starters, I mean, I'm a big fan when I talk to patients. I like to like kind of have this idea of what is normal or what are we meant to be like, right? And in my belief system, I'm a Christian. How did God design us first? So then you can understand how we're now falling short of that, or how what's happening now is not um, correct, or how it's kind of causing dis-ease in a sense. And so, I mean, to get to a few pointed points, 100%, I think this is where the systems kind of overlay so much that it's hard to even comprehend, but, tongue posture is a huge thing, right? And I think if you get into some of the Weston Price concepts and why our jaws are not developing fully, our diets, the agricultural revolution, all these things, right? When we are not developing appropriately, now we kind of start to affect our airways. You talk about sleep apnea, OSA. You talk about kind of mouth breathing instead of nasal breathing, which is a huge, huge one. There's some fascinating books in the literature on that. But to get pointed on like tongue posture, if our tongue is kind of like a rudder, like a boat rudder in a sense, is how I kind of look at it. And it either can guide everything into health and wellness, or it can guide you over a cliff. And in a sense, our tongue is meant to be where we're supposed to be. It's meant to be high up to our hard palate and helping develop the jaws. And that's where it should be sitting, keeping the nasal airways kind of open and patent and things like that. And your maxilla development goes along with that a little bit. If your tongue is tied to the floor, if you have a tongue tie, or it's just sitting down and forward, that'll transition into the upper cervical, and some of those musculatures would be kind of the same way. I mean, that's in addition to everybody sitting on their phone all day forward, right? I mean, that's like keeping you in business. It's like job security, the way that they do that. But I kind of look at it as tongue down and forward means your posture is more apt to be down and forward. And then, as you know, how that messes with your C1, C2, and the kind of the domino of the chain there.
Right. And so we get asked like, why do kids get adjusted? It's like, it doesn't have to be this big, huge slip, fall, like traumatic experience. Like someone might seek chiropractic care. It can be something as simple as, yeah, they had a tongue tie when they were little, or there was some other sort of like birth trauma that led them down that way.
Yeah.
I think one thing that you said earlier that was so telling, I say this all the time. So clearly we must be on the same wavelength, is that we've normalized things that are away from God's design, meaning that we've normalized headaches. And I say often, there's a big perceptual difference between common and normal. And in America, I would say that headaches have become almost the norm.
Mm-hmm.
And I think in reality, they're common, but unfortunately they're not normal. And it's that warning sign that something's going on.
Totally.
So
totally.
we can do, and like you said, if we just treat the headaches per se, but we don't get to the actual root cause, we're going to keep going down that road. And then months go by, years go by, and it just becomes, unfortunately, it does become normal because we don't know life without it.
Totally. And I think that goes back to the point of kind of this integrative care where, I mean, I'm simply a dentist, right? But at the same time, if we're not working with other practitioners, such as yourself, or such as people that are like-minded, functional medicine, naturopaths, whatever it may be in the scope, and even your primary care physician, I mean, a lot of times they're open-minded if they can understand some of these things, right? Whoever it may be, having a collective and integrative approach to patient care is how it should be. I think I have this like dream style of clinic where you have multiple people like us in one building, and you all sit down at a table and talk about one patient. This is what I'm going to do to affect this, that, and the other. And that's just tough in today's world to happen. But like you said, there's a root cause, but there's like layers on that if we don't have a concept of what's going on with these layers and these integrative systems, again, you start to normalize those things. And that's crazy to think about. It's normal for people to be on 1, 2, 3, 5, 10 medications at once. Yep. It's crazy to think about, but it's totally true.
And I think about that where people come into the office, and I often ask them like, hey, what was if say they're on 7 medications, I'll ask them like, hey, what was the first thing that got some of this going? And they oftentimes can't remember. And that's just like, that's sad to me. That hurts my heart in a way that it's just like, I often, if I'm the patient, I don't know. I kind of got to this point and I don't know where to go now.
Right.
And so it kind of just takes that, like, I say this too, like all healing starts here in our brain. Like, if we think that we're sick, I don't care what type of intervention, or if you don't believe in that, it's going to be tough sledding. Right. And so I think that as you're meeting with people, what you're saying, I would love to, we'll have to talk on that. We'll get everyone together, get all the disciplines, and just like have this really awesome office. But as you come together on that, people actually have that hope and that encouragement, rather than just being like stuck in such a negative thought process and not
Yeah.
allowing to think like, oh, this can get better.
That's the first, in my opinion, 100% agree with you. That's like the first straw that needs to break. I see in today's world, we're like just inundated with information. And when you get into this realm of this more holistic or medicine, integrative medicine, you start to read things and you start to learn, like all of a sudden you feel like the sky's falling. It's doomsday and there's no way you can get healthy. There's no way. You've made so many mistakes that you didn't know you made. You don't know how to read a label because it's always like, unless you have a full-on biochemical degree, you can't read a food label in today's world, right? So you get kind of caught up and you think, the hill is too hard to climb. And I kind of think the opposite. If you're kind of always in a glass half full mentality, mentally, that's the first biggest step. If you can't get past that, hey, I can do better, I can go from here forward, then you never will get better. And I, ironically, and I'll say it publicly, I have turned down doing surgery on patients that are not mentally there because I know their healing will not be good. And I know that they won't be able to get the best out of their system because they're shut down mentally. And I know that's a really tough thing to say, but I've done it and I'll continue to do it because I truly think unless you're mentally there and ready to do some things, like get yourself right first. That's the biggest thing.
That's so true. Cause it's just like, if you can have all the shiny bells and whistles, right? As far as a practitioner, you can have all the things as far as their care, but if they're not allowing themselves, and there's a guy that his name's Joe Dispenza. He talks a lot about like, he actually wrote a book called "You Are the Placebo," right? Basically, and I don't mean to summarize the book in one quick sentence, but it's basically like your brain is connecting and dialing in so much of that in your own body. And if your head is heavy, so is your heart. So it's
That's a good line.
and if you're not able to allow that, because I think we oftentimes think about, I have a couple orthopedic surgeons that I refer to, whatever else it is, like I'll tell people, hey, if you sever your arm or whatever else is, like, I'd love to see you, but like, don't come in. Like, you need to go.
No.
Go get
I said the same thing. Say car accident, your leg gets lopped off. Go to the ER. Don't.
Right. I love that you thought of us, but like, you need to go somewhere and get that checked out, or it could be like, say referral for like an Achilles or an ACL or something like that, right? We oftentimes treat our organs or our different bodily things as if it's a joint like that too. And there's a whole healing process that needs to happen as far as our stomach, as far as all of that. So when people want that, I think we think similarly that like the instant gratification of some of what we do can be a year down the road. Like people often ask, like they'll ask me when they're gonna start feeling better, and I love to give them the canned answer of like, oh, tomorrow. All it's gonna take is one visit and everything. But like in reality, it might be 6 months down the road, it might be 6 weeks. I don't know. As a Christian too, like I can't control that, but what I do know is we're gonna do the right things to see your body start to heal, right? And I love how you actually approach that as far as what each person's a little bit different, and they should be treated as such. And I think one thing that really defines a good practitioner, whatever your discipline is that you can see the person as they are, and not be a hammer that only sees nails.
Yeah.
Right. And and getting someone to be able to say like, hey, I want to give you care, but maybe this isn't the right time for you, or as far as the surgery and stuff like that too. A couple of things that I just wanted to go over with that. You said earlier about like tongue ties and that effect on breastfeeding and things like that, or just as that kid is maturing. What are some of the best recommendations as far as parents, if they notice something like that, like what should they do going forward there?
Sure. Yeah. I mean, full disclosure, I don't see kids. I see mainly adults. So that makes it a little bit tough. But the first thing I want to say, I think looking for a tongue tie, honestly, should be part of like right away, like in the hospital, neonatal unit, whatever it may be. It should be one of the things that they're looking for, because of the impact that it can have on people. If anybody's read James Nestor's book, Breath, or Michael Gelb's book, Gasp, there's good books on airway and breathing and how this all kind of correlates together. But the first thing is to try to get them to a specialist to assess the tongue tie and then treat it, which is basically a really simple procedure nowadays. That's the biggest
Is it a
thing.
laser
Typically the best way is a laser, but honestly, people have done it for years. I mean, this sounds that bad, but old school, like scissor clip, that type of thing. But I like lasers. We use a lot of laser therapies in our practice because of the body knows what to do with wavelengths of light, and it's much less invasive. Healing and regeneration is much quicker and easier afterwards. So I like laser for that type of thing. But and there's a lot of functional or biologically minded dentists out there. So that would be the first probably place that I would look. And I'm sure pediatric dentists, I would hope at this point are kind of looking at that as well. So, but it's always worth a phone call.
Yeah. And a couple of things that I think became in vogue that I just wanted to like see what an actual like, professional thought on this. Oil pulling, like coconut oil pulling, stuff like that. Like, does it actually replace mouthwashing or like mouthwash, or like what are your actual thoughts on that? I remember there was a time where like probably 3 or 4 years ago where I was just like, I'm gonna do this every single day, twice a day, and still brush my teeth too. But like, is there actual benefit to that? Is it kind of more? Or go ahead.
Yeah, no, good question. I think in this realm, at least I'll say professionals that aren't in this realm are kind of looked down upon, kind of a little more of a holistically minded or functional, biologic, whatever you want to call it, kind of approach. They usually will think that we're kind of performing just like a bunch of voodoo and that we're kind of full of it. And I want to say, first and foremost, that we like to base as much as we can in literature, right? I mean, of course, research now, we have to say at the first end, research a lot of times now is either bought and paid for. So you have to look at who's funding literature and where it's coming from. And just because there's not research on something doesn't mean that it's not true. It might mean there's no money to be made from it, but it doesn't mean that it's not true. It just means it hasn't been proven yet in a clinical setting. With that being said, there is a fair amount of literature supporting oil pulling. In fact, in the last few years, I have 4 or 5 studies just sitting in my computer right now, kind of showing that it's an old Ayurvedic practice that has kind of one of those things where you look back and you think, oh, these people, we know so much more now. We've gotten kind of ignorant, I think, where we think we know so much. We're so much smarter. And I kind of think it's backwards. I feel like as we think we're getting smarter, we're getting kind of dumber. I don't know what it is, but there's a lot of good benefits to oil pulling. There's a lot of literature-based research on that. Best things are coconut oil or extra virgin olive oil. Some studies will have sesame oil in there as well. But it works very, very well. Supportive of the oil microbiome, cleansing out fat-soluble toxins and things like that, supporting diminishing plaque scores and helping with that. The way I like to do it, or at least we coach people on it, is it's kind of a pain unless you make it a habit, just like you said. And it's hard to make something a habit quickly, but what we like to do is get the little silicone, like small mini ice cube trays, melt down in oil, because coconut oil is saturated fat, right? So it's more solid at room temperature. Melt it down, throw it in that ice cube tray. You can put a drop of an essential oil or something like that in there to support it even more. And then let that just set up, and then pop those into like a mason jar and just put it on your countertop in your bathroom. And that way it's like a single serve, quick swish. No one does it for 20 to 30 minutes. A couple minutes, 4 or 5. If you can get to 5 minutes, perfect. But don't let people think that you're going to do it for 20 minutes. Like your jaw will get just tired as all get out.
Totally. Obviously have TMJ. She's like, hey, what happened?
Yeah.
And I think one thing, just like to a little bit of a tangent on that too, but I was actually watching a video. Lane Norton, he's on Instagram, and he was talking about how so he's a PhD in nutrition, and he was talking about how people that really are invested and do the research, oftentimes they'll say words like it suggests, or like it's like science is always like evolving, right? And then that's like actually, to me, that's one of the big definitions of science too, is that it's always growing too. So it's like it can be a little dogmatic sometimes, say, hey, absolutely 1,000% this works, I know that this works, whereas in reality it's like we're always getting new studies, we're always figuring out like,
right,
where are we at?
Yeah, we should always be willing to learn more, be open-minded, and kind of transition once we kind of understand some of the literature. And that's tough too, because there's a lot of research and things that are like conflicting. I mean, we live in a day and age where we have veganism and we have carnivore diets. So it's like you can't even be more polar opposite. And so it's hard to kind of get through the weeds sometimes, for sure.
Totally, because we'll slow down with people and just say like, hey, like, how can we help overall? Like, how is your nutrition? How is your exercise? Like, how is your mindset, or things like that too. And they ask, hey, what's the best? I get asked that a lot, like, hey, what is the best diet? And I just pause. I'm like,
Yeah.
Don't
Can't
have
answer
a
it.
name for it. You know, it's like,
Different. I mean, you said that too earlier. Like everybody's unique, and you don't know people's blood work and like how some of this stuff is going to. It's tough. It's a hard area to navigate. I'm a big believer in just balance in general, in life
really,
in general, and all the things. I don't think you can
yeah.
go too wrong with mostly balance. It's when you get on the extreme ends that I feel like that's where you can kind of get in trouble in a lot of things. And so I believe in balance, but I know there's a lot of benefits to a lot of different things that just everybody's unique.
And something that I like, again, talking just as far as like my belief and whatever else, is like food is God intended, right? Like if you're eating things that are whole foods that don't have a 19 ingredient list thing
Yeah.
on the back, like I think you're going to be doing pretty well. It's when
Yeah.
we get like into this full on, like, one thing that I was talking about with someone who was like the like keto diet has been popular and vogue and stuff like that, and they'll go to the local grocery store and it's 5 or 6 times the price of like keto cereal versus like cereal in the non like healthy section or whatever you want to say. And oftentimes like there's still a lot of fillers to it. And you can say, hey, like this cereal, I paid a lot more money for it, doc. Like I feel so much better about it. I'm like, hey, in reality, like I think if you had some eggs, like,
Yeah.
and I'm not, you're never trying to belittle them for making a choice for themselves, but just saying like, hey, like there's still a lot of really like processed oils in there. There's still a lot of fillers that
People are good at
what
marketing.
a marketing label on the front, on the back, it's like, I'm not
Yeah,
gonna
I
do it
mean,
all right.
you're like always on in defense mode a little bit. Like you're always kind of like you're always barraged by marketing. I mean, that's a great one. I had a patient classically, gosh, this was a while ago, but they same thing. They were doing keto, and for some reason they didn't feel like they were doing too well, but this, that, and the other, whatever. And so I just asked flat out, "Do you still have a gallbladder?" And they had no, they had a gallbladder removed a long time ago, so they weren't processing fat. So they're loading up on fats,
Right.
with no gallbladder and no supplemental, enzymes, lipase, whatever it may be, right? And so it's just that's one of those things where you just, like you said, things are just vogue and they look flashy, and you grab them, and you're always looking for a quick fix, right? When you live in an Amazon world, I want things now, and that's not the way health really works.
Well,
Um,
and in reality, it's like I say this a lot too. Like nutrition can be simple, but it's really nuanced based on the person. And we can
yeah,
have these general foundational things that yes can like check a lot of the box for people. But yeah, if you've had a gallbladder removal and you're trying to do, and no, I get the bulletproof coffee. It like I get that thought process, but like if you're having 2 tablespoons of butter with your coffee and then some coconut oil and then MCT oil, like that's gonna be tough because you don't like your gallbladder isn't processing that the same way.
yeah,
But if
yeah.
I just have these huge statements on that overall, and sorry, I know we're getting a little more nutrition than maybe planned, but like,
No, and you're right. It's the foundation though. I mean, like, and I agree with you. I like to think in just whole food. Every patient that comes into our office, every new patient gets like a whole host of things that we do in the clinic. And then they get a follow-up email with a lot of results from what we did. And then they also get a food design concept by a colleague of mine named Dr. Dominik Nischwitz out of Germany, which I think has done a very good job about nutrition. That is basically just whole foods.
yeah,
Sense. Like how can you can supplement areas where you think you might be low, but if you can stick to like just what you said, God's design, food is medicine, whole foods, stick to the outsides of your grocery store with that, those type of mentality type things, I think you can't really go wrong there.
right.
At least you can't
And
go
then from there,
tragically.
like you said, you can level up from there and say like, hey, based on your history and where you're at and what your goals are. Like I think we have similar thought process too. Like as a provider, like we need to ask people about their goals. Like what are your actual goals? Are you wanting to run a marathon next year? Are you wanting to like compete in a CrossFit competition? Are you wanting to like sleep better? Like everyone's goals are so different. And for you, like to be like to hear you say that earlier too is refreshing for me because we kind of just like we always want the same thing for each person. And
Right.
that's where like you have like your viewpoint, and that is so similar in that you're able to actually meet people where they're at and lead them. And one thing that I saw too, and I wanted you to expand upon a little bit, is that when people come into your office for the first time, you actually do vitamin D testing, right?
We do.
So tell me a little bit about like why do vitamin D testing as far as new patients, what you're looking for as far as like dental health, and then overall too.
Sure. Yeah. Yeah. I mean, to start like two steps back from that, I think people come in, and one big thing in dentistry, for example, is cavities or gum disease. Right. And those are the low hanging fruit is what I call them. The things that people are used to knowing that they go to the dentist for. Cavities, people can have cavities and things don't hurt. So then it's kind of one of those things where it's like, well, do I really need to get fixed? Does it hurt? that type of thing. And so when you're looking at things from a holistic view, we're talking about diet, nutrition, those type of things. But we know from literature that if you have a low vitamin D, which a lot of people do nowadays, especially in the winter, and especially in northern countries, northern states, things like that,
Iowans, yeah.
you're gonna get a low drop. Your vitamin D is gonna drop, and then you're gonna basically hinder your ability to absorb certain minerals that lead to or that can mineralize your tooth structure, basically. So if you're not getting your minerals in correctly, that's going to spell a little bit of trouble. Also bone health, tissue health, those type of things as well. If I'm doing a surgery on somebody and they have a lower vitamin D, literature has said over and over again, you will have, for example, you will have a dental implant fail if you have a low vitamin D. So I don't want to put you through a surgery knowing that it's got a pretty good job at failing. I'm not about burning people's money. So you kind of have to assess those things. And then I'm always saying, hey, if you can get in the sun, that's your best way, because there's so many other things that can come from sunlight. And then you have to supplement if you can't get there, right? And that goes to where we don't try to think myopic in a sense too. Vitamin D is one. I kind of liken it to an orchestra, or if it's a male patient, I'll say a football team or a soccer team. But like all these things work in concert together. So vitamin D is one in the big picture. It's a very, very important one. But it's one in the big picture of other things that have to be kind of on par. And so so everybody gets a vitamin D test. A lot of times people don't know what their vitamin D is. A lot of times people will say, I've been supplementing a long time, so it should be plenty. And then we test it and it's low. And so either their supplement's not working for them, or it's a completely garbage supplement in general, right? So it gives us a little bit of an open door to start discussing nutrition and things like that, knowing where they're at as far as, like you've said, gum disease, which is the same thing as leaky gut, but it's leaky gum, same thing in the mouth, same idea. And then kind of opening that door to talking nutrition. Gluten's another big one that we talk to a lot of people about. So there's a lot of tentacles to at least get a patient to know, hey, your cavities are not a lack of fluoride. They're not a lack of a known neurotoxin. And we kind of think that cavities, okay, we have to do some fluoride on people. And I'm not a big fan of fluoride at all. But it's not a lack of fluoride that's why people have cavities. Right? And so it's a different mindset.
Yeah. Right. No, that's so true. That is probably, as I get the question I get asked about people trying to make these changes, we talk about like lateral moves, like, for example, maybe instead of Skittles, you have more of we have our son has these little, they're like little things of mango, like they're almost like dried mango in a way. And it's literally the ingredients are organic mango, right? So it's like trying to make these lateral swaps where you're still able to enjoy the things that you want to, or like maybe instead of like a really gluten heavy pasta, like figuring out some substitutes, right? I get asked a lot, like, what toothpaste do you recommend? I'm not a dentist. What are some things that we can give people, some names, some brands, things that you sell in the office, or just things that they can look for to actually level up their toothpaste?
Yeah, sure. So, good question. To piggyback on that, you asked about mouthwash earlier. I'm not a fan of mouthwash by and large. So you go down in the Target stores and Walmart, things like that. When they come in the vast arrays of colors, that's probably not good on the oral microbiome. Yep. So that's kind of where everything starts is the oral microbiome, similar to the gut microbiome. And they're kind of like talking sisters. They really ebb and flow off of each other quite a bit. So if somebody has a wrecked gut, in a sense, they'll most likely their mouth is going to be wrecked as well. Right. Mouth is also at the mercy of whatever's installed in it, is what I usually would say. So if you have metals installed in there, if you have kind of garbage materials installed in there, amalgams, metals, things like that, those are going to affect the microbiome as well. In a unique standpoint, coming from that kind of global view, every patient is different. So it kind of is depending on what is the patient presenting with. If they have a history of cavities and things like that, of course, we look at gut first. But then I like products like Risewell or Boca are two toothpaste that you can get online. Everything that we have, usually people can get online themselves. I'm not trying to be a pharmacy, but I want to make it easy if somebody wants to grab it on the way out the door. But I also want you to go home, check it out, make sure it aligns with your values as well. The component of Risewell and Boca that I like is hydroxyapatite, which is the mineral found in tooth structure. It's much more bioavailable since it's already found in tooth structure. It's a natural mineral. So the uptake is better. And we know from plenty of studies that will say hydroxyapatite works just as well or better than fluoride. And you can swallow the whole tube and you're not going to have to call poison control. So that's where my box is checked and we don't need to have fluoride anymore. If somebody has a history of periodontal disease, I like, there's a product called Biocidin, which is a really good for support and trying to convert the microbiome over to a more healthy based one. So again, it's a little bit nuanced on what the patient presents with, but those are 3 really good ones. I mentioned the follow-up email that patients get after they come here as a new patient. On that email, there's a section that's called the perio protocol, which is super simple. It talks about using things like peroxide, baking soda, and a water pick or as a toothpaste. Those things are very oxygen rich and very alkaline in a sense where they're going to bring up the pH and support the system. So we see a lot of people just simply off stuff like that, if everything else is in check, does really good. And people have those things around the house.
That's so telling it. And I love your approach on that too. And you said it even earlier, as far as like, if someone's a good candidate for a surgery or not, if their vitamin D is low, like an ounce of prevention is worth a pound of trying to treat it later. Right. And you can keep saying, hey, we'll keep doing more surgeries. But in your heart and your intention, like that's not what you actually like chose to do what you do for.
Right. No, I don't want to keep doing it to somebody. I'd rather do it once and be done.
Right. It's like there's a reason why, like I haven't said there's a method to our madness, right? We want people to actually like have health through this, not just keep saying, oh yeah, this is gonna be bad, this is gonna be bad, this is gonna be bad. Like what if you actually give people hope?
Right.
And they trust in you and they believe in what you do versus just like, hey, like this is really, really bad. Like that's not what we want to do. Like I want to practice for a very long time and I love what I do. It sounds like you do too. It's like that's what's fun for me when people get it. Like people understand why they do what they do as far as their health overall. And like you describing that is so telling too. And it's fun for me to be able to share that. I had a whole thing here talking about microbiome, but maybe that's for another talk. Our gut microbiome, mouth, we have a microbiome in our sinuses and even skin too. We carry like I said, I don't want to be a pharmacy either per se, but we want to be able to have good resource for people. We have like Ion, which is a company that does like gut health and sinus things. And it's just like, what if we just create a stronger barrier because we have so much stress in our environment, right? We are inundated with things outside of us, and we're just trying to help our body function that much better too. So I appreciate that you talked on that a little bit because it's tough to be able to control everything that we are exposed to, right? Is that fair to say?
Yeah, and I mean, we like to assess the microbiome at least a little bit. So usually every hygiene appointment, every time somebody gets a cleaning and things like that, we take a sample of the plaque, we put it under a microscope, and then we project it to a screen so people can kind of see that microbiome. Then we can kind of say, hey, these are bugs that you don't want. These are really good bugs, right? We've been conditioned now to think that bacteria is all bad. These things are all bad and in fear, when it's really like, I mean, there's trillions in, on, and around you at all points in time. And there's some of them are very, very good. Like we can't really exist without them. So it's not really about sterilizing the mouth, which is kind of what people think. We're going to clean the mouth, we're going to sterilize it. No. We want all the good guys.
Right.
Being a guy, I grew up with Ninja Turtles. And so I want a bunch of good guys and not a bunch of villains in there, in a sense, is how we kind of verbiage it to patients. But when people can see it on a screen and kind of start to understand, hey, this is a whole ecosystem. I want to culture it like a garden. I don't want to kill it. That's a big mind shift for people.
Totally. And that's what we do, the exact same thing as far as going to people's x-rays. I sit down with them and say, hey, here's what's going on. And there's that point of empowerment, like, oh, now I understand why I feel the way that I feel. And you can just gloss over that and just say, hey, like you got to do this, you got to do this. But when people feel that empowerment, like, oh my gosh, like this is actually like, this all makes sense. I'm glad that I'm here. I love that I'm here. So again, thank you for doing so.
Yeah. And too, like you could be the best chiropractor in the world, and if people don't understand what's going on and make that mental decision that they want to be involved in it and going to go home and practice what you are trying to help them with, right? Moving more, stretching more. Like there's all these things. Same thing with us. I could be the best dentist in the world, but if I can't get somebody on board and kind of understanding at least to what's going on, then they don't have that much motivation to go home and brush their teeth every night. I mean, you know what I mean? So
totally. Yeah.
Once they get on board,
natural habits.
Yeah.
And you think about motivation can wane. Like we can be super motivated, but then life happens. It's like, how do you actually help people establish good habits for their life going forward? And outside of our walls here in the office, like what are they like? How can you help them instill those healthy habits? You don't have to be perfect. I always tell people, as a reformed perfectionist,
don't shoot for perfect because you'll fall short every time.
I tried to be perfect for all of my life, and I was always chasing that like thing, and I never got there. As far as like always trying to be perfect, it's like in reality, it's like just how do you create good healthy habits for now and going forward too. You have a busy day. I'll let you go. Just how can people like find you, your office? Like, how can they follow up if they have any questions or want to schedule an appointment? Like, what does that look like?
Sure. Yeah. So office is Corridor Dental. We're in North Liberty, Iowa. Obviously, you can get on our website, corridordentalnl.com. And then I'm on Instagram quite a bit. And so people can follow me on there. And I'm always trying to post different things. And sometimes I also use Instagram as a way to just kind of connect with people as far as like I'm a human being. Like I have 3 kids. Like that's always good too. Like when you can build some trust with somebody that says, hey, I mean, I have 3 kids too. Like this guy, like I get it. We have things in common. And so we're always trying to use that as a kind of a tipping point too of saying, hey, we're all in this together. We're all in this world together. And we're all trying to navigate, at least like-minded, like yourself. Like a lot of our patients come in like-minded. So we're always trying to just connect with people in general. So those are probably the 2 best ways to reach out or at least get connected with us.
Awesome. Thank you for your time. People at our office will appreciate that. It's just fun to be able to keep sharing and keep leveling up. And have a great day. Thank you.
Awesome, man. Thank you.